St. Mary Medical Center broke ground today for a $22 million expansion of its emergency room and trauma department, transforming the care for the community. Can you just give me a little background information on what prompted the expansion and just kind of speak about what's going to be happening today?
Well, over the last 5 years, the emergency department at St. Mary Medical Center has grown by almost 50%. And we have an emergency department that's designed to handle about 50,000 patients a year. And this year we're on target to see almost 70,000 patients. So we've had a real operational need to be able to provide better services to our community with more space and better operational flow.
You're serving patients in Bucks County. Are you also serving patients in the Philadelphia region that are coming up this way? Because I understand this is the only trauma center located in the county.
St. Mary is the only Level 2 trauma center in all of Bucks County, and there are no Level 1 trauma centers in Bucks County. So our trauma patients cover a very wide area that covers virtually all of Bucks County, as well as eastern portions of Montgomery County and the northernmost aspects of northeast Philadelphia. In addition, we've been seeing an increasing pediatric patient population over the last 5 years through our Pediatric Emergency Care Center that covers New Jersey and Philadelphia as well.
Can you talk to us a little bit about the flow of the emergency room department? We understand it's going to be a two-tier system, and how is that going to help manage your patients that are coming in ambulance and those that are driving in?
At the emergency department at St. Mary Medical Center has spent the better part of the last 2 years looking at best practice flow so that we can not only provide the best patient care and the best patient experience, but also to maximize the way people get through our system so that we can minimize delays from the front door until the end of their visit. One of the things that we decided when we started this project almost 2 years ago is that we wanted St. Mary Medical Center's emergency department to not only provide enough space to care for what we need, and not only to provide the best staff and the best physicians to our patients, but to be able to design the entire process from start to finish to be the best practice and the model for the country.
You guys are expanding today. Can you talk a little bit about what that means for St. Mary's?
Sure. First and foremost, our commitment is steadfast to the community to ensure we have the best quality of care and service. Emergency departments are usually the area where people experience their first impression of a hospital, and about 40% of our neighborhood will use an emergency room at least once a year. So our expansion really includes 3 areas. A pediatric area, we're the only pediatric staffed emergency department in Bucks County 24/7. A trauma center, the only accredited trauma center in Bucks County, and then our normal emergency department as well. Currently, we care for about 70,000 people a year through our emergency and trauma center, our pediatric center, and we expect in the future, as our community needs more services, we'll care for about 100,000 people a year as well.
We were looking at the expansion, the boards that they have out there. Can you talk to us about the flow of what you guys are expecting, hoping that this expansion will help ease that flow?
Sure. I think anyone who sees it goes to an emergency department, their first concern always is the timeliness of treatment. The new design is going to greet each person with a nurse. So rather than registration, a nurse will greet them, triage them, and move them directly to an area of immediate treatment. So the biggest change will be the immediacy of treatment, which will reduce treatment times, and our hope is the ability to treat people in a very short period of time and get them to their appropriate level of care.
Is this going to affect treatment with the expansion and the construction going on?
During construction, we don't see anything changing. The area we stand in today is where the expansion is going to occur. So it's a grassy area today, and so we'll be filling that in. So people should not expect to see any changes in their emergency care during the construction.
To announce a partnership with an extraordinary grant from Bristol Myers Squibb. This generous grant will support the Bristol Myers Squibb Pediatric Emergency Care Center at St. Mary Medical Center. St. Mary is the only hospital in Bucks County that is dedicated 24/7 pediatric emergency care center, which includes a separate setting for pediatric triage.
Thank you, Sue. Good morning to everybody. On behalf of Bristol Myers Squibb Foundation and my many Bristol Myers Squibb colleagues who live here in Bucks County, I'm pleased to announce our $2 million gift, creating the Bristol Myers Squibb Pediatric Emergency Care Center at St. Mary Medical Center.
I was reading that it will be more family friendly. Can you talk to us a little bit about what features that includes?
Sure. There's going to be more pediatric services available for families. Again, get the patients in feeling more comfortable, get them out quicker so they can get back to their daily activities. So it's going to be a all new process design, beautiful atmosphere, very family friendly, kid friendly. We're excited about that.
We understand it's going to be a 2-tier system or kind of a split level treatment. What does that mean for patients coming in?
What that means is that we'll be able to, again, care for the people who are able to be treated and leave quicker, and then also be able to care for the people who have a higher level of acuity that need more intense services, be able to get them, again, back to see their physician very much more quickly than they could if we were trying to triage both types of patients at the same time.
Can you talk to us about where the resources came for this expansion?
Sure. The majority of the funds are coming through our operating operations. Also, probably a little bit more actually through financing. We've done some debt issuance through our parent corporation, Catholic Health East, and then also through funding through donors who have been very kind throughout the community, including corporations.
The new expansion and redesign will provide care for up to 100,000 people annually, which is nearly double the current capacity. Reporting for Patch.com, I'm Salika Khan.